Hi guys, today we're going to talk about Contoura, an amazing platform to have a correct personalized treatment for your patients. One of the important things here is to understand that it's a simple procedure for normal eyes. Sometimes we believe that this is for very complex eyes, but it's not. It's for normal eyes. The second thing is we're going to talk about the pre-operative studies, and topolizer is going to have a very important role in that. What are the barriers to do Contoura? One of the important things is it takes more time, but then again it's 5 to 6 minutes, and I will ask you, what do you think about perfection? If you can give 5 more minutes to an eye and have perfect results that we have in evidence. The second thing is about knowledge. Some people are afraid to leave their comfort zone, and I think that's going to be the important thing. Inclusion criteria, as we said, normal eyes. It's going to be myopic or eyes with astigmatism. Of course, they have the ability to have refractive surgery, but also they're going to be virgin eyes. These are not complex eyes. These are virgin eyes with myopia, astigmatism, and one of the key points here is to have the power of astigmatism is not going to be different between subjective and objective results, the 1.25 diopters, and the axis cannot be different if you have less than 2 diopters, 10 degrees, and if you have more than 2 diopters, 5 degrees. With this in mind, the important thing we want to transmit you with Edith here is the value proposition of Contoura. And we believe it's very important to have a centered corneal vertex treatment. That's very important. We're going to discuss that further. The second thing is you're going to have a complete cyclotorsion compensation. And the third thing is you're going to be treating high and low aberrometry problems, okay? You're going to compensate with the aberrometry, high order aberrometries, okay? So now we're going to go for the patient. Come with us, and Edith, please be with me here. We're going to have an eye. This is a left eye for one of our patients that has a minus 121 diopters of myope and 0.50 diopters of astigmatism. We did a complete, pre-op study. This patient, it's a candidate for refractive surgery, and well, now we're going to leave Edith, that she's the expert in how to personalize this to Contoura for the treatment.
Thank you, doctor. Another thing that we can take from this OPD exam is about the pupil size of our patient. This is something so important because if we wanted to really personalize the treatment, we must take care about our mesopic pupil size. So in this case, our patient has only 5.95 millimeters. So I do not need really to use 6.5 millimeters of pupil or optical zone for this case. So another important thing we may see, and in my experience with some doctors that are treating Contoura vision patients, is about the astigmatism. Total astigmatism, not only in the cornea, also in the internal cornea, which takes care about the posterior cornea and the crystalline lens. So sometimes when some patients has a big amount of internal astigmatism, for sure they are not going to be in these criteria. So we can choose another treatment, such as wavefront optimized or custom Q or another ones. So this is also important to see in this picture. After that, we should make 8 exams to topolizer, which is the equipment that is going to give us 22,000 points of elevation that we are going to take care for the treatment. So this is a personalized treatment. The only digital sign of our fingers is the same in our eyes with this 22,000 numbers. So we need to make sure that we have a good quality of these measurements. And the topolizer gives us an advice. We have a P as in preferences, and the R, which means that we are going to have a iris registration. The iris registration is going to help us to make the cyclotorsion, which is so important for our patients, especially when they have astigmatism. So with this information, all of the equipments are in a wavenet, in a red. So we send the information to the excimer laser, and we have it right here. So as we can see, we have the information for both eyes, right and left eye. In this case, we are going to focus just in one eye. We choose the left eye for this case. So we go to planning, go to Contoura in the left eye, and all of the pictures that we took in the topolizer, all of the exams are be there. So we have to check also previously in the topolizer the quality of those images, but also we can have a quick look here to see the values. So as we can see here, we have this map for the registration, which has the asterisk, and all of the maps looks very good. Maybe we can also look if there are someone that we can dismiss. Maybe this one, just because it has the sign to suspect. So we see the pictures remains almost the same everyone's. So we can continue to the next step. So we put here the refraction of our patient, which is minus 1.25 sphere, minus 0.50 diopters in the cylinder at 172 degrees. The information about the keratometrics are already there because topolizer give it to us. We put the pupil size, as I mentioned before, it was 5.95, so it closes to 6. And the pachymetry of our patient, and we continue for the next step. Here is where the personalization starts. We are going to take care about our refraction, but also about how much amount of astigmatism measures the topolizer. So in this case, as we can see, we have minus 0.5, but the topolizer found minus 113. So we have to make the adjustments. First of all, as Dr. Ivo mentioned, we don't have more than 125 diopters of differences, so we can continue with Contoura. Regarding the axis, we have less than 2 diopters of cylinders, so we can have at least or as much 10 degrees of difference. In this case, we have less than 10 degrees, so we can continue with Contoura. The personalization is about the, I leave my calculator. Sorry, you need a calculator because we are going to, first of all, for the axis, I'm gonna take always the topolizer axis. So in this case, I'm gonna choose 1 degree, and I'm going to make the middle value between the refraction and the measurement. So we are going to make a simple calculation. We are going to take 0.5 plus 1.43 divided by 2. So my real astigmatism that I'm going to take care is minus 0.96. So you can see these values are not common because the autorefractor cannot measure the higher order aberrations. So these values are taking care about the lower and higher order aberrations. That's why, and that could be the reason that we have this difference here. And if we can show here, maybe we can look at about the Cernic map. So we can see the higher order aberrations of our patients that has a big comma, and maybe this comma is the causa that is causing this difference between the astigmatism. So autorefractors cannot take care about the comma. So topolizer can do it. Well, now we have our cylinder. And with this value, I'm gonna see how much is the difference between this value that I'm gonna treat and the manifest refraction. So I wanted to make the spherical equivalent the same as in treated as an manifest. So I'm gonna say this 0.96 minus 0.5 and divided by 2. So we are gonna make the spherical equivalent. So, and I'm gonna subtract to the sphere this value because I am adding more astigmatism than my patient manifest. So minus 1.25. So my real refraction on a sphere it will be 1.02. So this is the real refraction that I'm gonna treat. I am making equals the manifest refraction and the treated refraction. So by now I can, next page maybe. By now we can apply our nomogram if we decide, or otherwise we can continue with this. Personally, I always like to add the nomogram that comes with the laser. So in this case, for the sphere, I have to add 0.25. So I'm gonna place it. And the results are really very, very good. I have some doctors that are treating all of their patients that accomplish this criteria with Contoura vision, and they have 20/20 for sure, and in some cases better than 20/20. So we are ready, doctor. I'm just gonna close the optical zone just because of what I mentioned about our patient, and we are ready to treat our case.
So now it's my turn, right?
Yes.
Thank you so much, Edith. And I think it's very important for you guys to understand how you can personalize a treatment. And when we say, it takes me more time, I think it's the best time you can invest with your patients to have something that we have also in evidence-based medicine, that it's proved that you have something called beyond the 20/20. You have such a great quality of vision for your patients that you can do it. And this video is going to be for you, to give you all the tools for you to start doing Contoura. Mm-hmm. And here is what you were talking about, yes. Right, Edith? All the
here
detail.
Is step by step what I did. Maybe it takes a little more minutes, but believe me, in the practice, when you are starting to doing by day, patient by patient, you are gonna see your time is less every time. And you can have a quick review of your patients very easily.
Correct. So right now, let's go to the treatment, right?
Let's treat this patient.
So I have the best help in the world. Edith, it's so great. So right now, what we're gonna do is we're gonna treat our patient. Okay?
Yes, we are ready.
One of the important things in this moment, remember, we always say, is to center the eye, to talk to the patient, to have a calm patient, to talk about how many seconds the treatment is going to take. In this case, how much time it's going to take?
5 seconds, 6 seconds.
Oh, it's good. Great, because it's
please try to use this for the pupil.
Yes.
Okay. This here. Center the eye.
So we're gonna trick it's very important to trick the machine with a fake pupil because we're doing simulated surgery.
Yes. We are ready.
And now we can do it.